is Elisa Konofagou. I'm professor of biomedical engineering at Columbia University. So ultrasound is a technique that we use in the clinic to typically image organs in the body that we cannot see by naked eye, such as the uterus during fetal development, or, for example, the heart, or even cancer in the breast or other organs. So it's a modality that uses sound waves, but at higher frequencies than what we can hear. And it allows to have these reflections in the body that then we can convert to images according to where these reflections are happening. In the case of focused ultrasound, we don't intend to image. We intend to treat the tissue and treat diseases such as cancer or other conditions such as essential tremors to be able to inhibit the functions. So the way it works is that it induces specific phenomena inside the body coming from the interaction of these sound waves with the body. These sound waves are interacting with the body by changing their energy as they propagate inside our tissues. And they cause either mechanical effects, so vibrations, small vibrations in the tissue, or they cause temperature elevation, so thermal effects. In the case of the latter, we can actually use focused ultrasound safely in the brain to be able to cause small thermal lesions deep in the brain to stop essential tremors. So those are tremors that are not normal in the body, that cause a small tremble in the extremities, such as the arms or the legs of a patient. And that comes from a small region in the brain that we need to is becoming arrhythmic, and we need to stop it from sending this electrical signals in the body that causes tremors. Used there in the brain to stop these tremors completely non-invasively, transcranially, that means through the human skull, and without radiation, without ionizing radiation, so without causing any changes in the body as an effect of radiation, ionizing radiation. Over the past 10 years, there have been several clinical trials that have tested focused ultrasound in several different applications. There are several applications right now that are FDA approved in the US and approved in the rest of the world. One of them is for example, prostate cancer, for ablating prostate tumors and being able to spare some of the nerves around the prostate that may cause some symptoms of patients. So this is again completely non-invasive and with a transrectal transducer or probe. And it can be done under anesthesia, but there's no incision. So it has been shown to be extremely safe and certainly much safer than what is the alternative, which would be prostatectomy or removal of the prostate. Another area that has been FDA approved is, as I said earlier, which is the treatment of essential tremors in the brain. This is also done very safely. It's a small lesion on the order of millimeters that can be induced in the middle of the brain and leaving the entire rest of the brain completely intact. So this is a small region on the size of a grain of rice that's in the middle of the brain that can be just induced and stop the essential tremor effectively and sparing the rest of the brain. Another application that's less used, but is one of the first applications that was used, was the uterine fibroid ablation. So this is something very common in women over the age of 40, where they have these fibrous masses that are typically grown in the uterine wall and cause symptoms such as hemorrhage or even pain. And they can be also treated transabdominally, so with the actual device going on the abdomen of the patient and having these acoustic waves that I talked about earlier being focused in the region where they're needed, in this case, the uterine fibroid, that we can potentially also ablate and stop the hemorrhage. Another aspect that's also clinically approved, also safe, is the palliative treatment for bone metastasis. So bone metastasis, metastatic cancers that typically are sitting in the bone area and sometimes cause pain to the patient, and focused ultrasound has been shown to relieve pain from this bone metastasis. It's also FDA approved in the US. The last one, but not least, is the treatment of colorectal metastasis to the liver. So these are metastatic masses in the liver, but have started from colorectal tumors, so tumors in the colon, and those are also treated with a technique called histotripsy, which is under the umbrella of focused ultrasound, again, transabdominally, completely non-invasively, without an incision, and being able to extend survival of these patients.
Hello, everyone. I'm Agessandro Abrahao, a focused ultrasound neurologist at Sunnybrook Health Science Center and University of Toronto in Canada. Since the early 2000s, we have witnessed an exponential growth of focused ultrasound application for brain diseases. Currently, focused ultrasound has FDA approval and is widely used around the world for the treatment of disabling hand tremor that has not responded to the typical medications, such as we see in some cases of people living with essential tremor or Parkinson's disease. This is achieved by the precise visioning of key areas of the brain using the acoustic energy from focused ultrasound. Recently, early-stage clinical trials demonstrated the safety and promising effects of focused ultrasound in treating other brain diseases, such as complex psychiatric conditions, including treatment-resistant major depression and obsessive-compulsive disorder, or OCD. Another revolutionary development is the use of focused ultrasound to enhance drug delivery to targeted areas of the brain. Most therapies circulating in the bloodstream cannot access the brain due to the protective layer called blood-brain barrier, or BBB. Focused ultrasound can change that by modulating and creating gaps in the blood-brain barrier. This creates a window opportunity for a wide range of therapeutics, including gene and cell-based therapies, to enter the brain tissue. The safety of focused ultrasound-induced blood-brain barrier modulation for drug delivery has been demonstrated in multiple preclinical studies and animal models, as well as in humans. Our team at Sunnybrook and University of Toronto, as well as other groups in North America and Europe, pioneered the phase 1 and phase 2 clinical trials, establishing the safety of focused ultrasound as a non-invasive therapeutic delivery platform in patients with Alzheimer's disease, brain tumors, Parkinson's disease, and more recently, our team conducted the world first trial of focused ultrasound in patients with ALS, or amyotrophic lateral sclerosis, or Lou Gehrig's disease, for enhanced brain therapeutic delivery. Out of hundreds of focused ultrasound blood-brain barrier modulation procedures done in humans, we learned that this is safe. The effect is temporary, as the blood-brain barrier heals within 24 hours without leaving scars in the brain. It can target large volumes of the brain if you need, and it can be done repeatedly if a therapeutic needs to be applied multiple times. Lastly, in addition to the rapidly growing clinical utility of focused ultrasound, the devices themselves are evolving. There are multiple focused ultrasound systems in commercial or research use, whereby a single or an array of up to thousands of ultrasound transducers are used. Some systems fit the transducers into a helmet or dome-like device that is then secured to the patient's head. Next generation helmets are now being 3D printed and personalized to the individual patient's head. The precise targeting of the brain is guided by real-time MR imaging or neural navigation system or acoustic feedback monitoring, or combination of those. I hope this summary highlights the excitement of this revolutionary area of using sound waves to treat brain disorders. Based on extensive preclinical work led by Dr. Isabelle Bear and Kullervo Hininen from our institution at the University of Toronto, as well by other groups, we learned the advantages of focused ultrasound in overcoming at least two main challenges for the advancement of gene and cell therapies for brain disorders in humans. First, focused ultrasound is a safe and efficient therapeutic delivery platform across the blood-brain barrier. A number of preclinical studies demonstrated that focused ultrasound enhances the delivery of large compounds or antibodies, viral vectors, and even large cells across the blood-brain barrier by modulating its permeability in a temporary and targeted fashion. Focused ultrasound allows the administration of a lower therapeutic load into the bloodstream, and still it enhances and increases the bioavailability of the therapeutic into the brain tissue by multiple folds. This can also improve the safety and reduce the adverse events of gene and cell therapy in other organs. Second, focused ultrasound allows for the targeted delivery of therapeutic to discrete areas of the brain. Most brain disorders typically involve focal regions or specific networks, at least in the early stages. For example, in ALS, the motor cortex is a key region affected by the disease. In Parkinson's disease and Huntington's disease, the basal ganglia are the more affected areas early in the disease. Therefore, it is desirable to deliver the gene and cell therapies in a targeted fashion to these diseased areas and kind of not interfering much with the other area networks of the brain not affected by the disorder. Before focused ultrasound, invasive procedures have been attempted with neurosurgical procedures by drilling boreholes in the skull in the operating room, for example. Focused ultrasound can achieve the same delivery efficiency without using incisions or in a non-invasive way. At this point, I believe we can foresee a world-first clinical trial coupling focused ultrasound with a promising gene and cell therapy in the near future for brain disorders. The foundational safety and feasibility studies have been completed in multiple preclinical models. The safety of focused ultrasound blood-brain barrier modulation has been demonstrated in humans with multiple brain conditions. Of course, the main obstacle here is to further mitigate risks of the procedure and the combination of the therapies. And this has been the focus of current research. But I believe it's time to accelerate partnerships between industry, regulatory agencies, funding and advocacy agencies such as the Focused Ultrasound Foundation, and academic societies and academic investigators to pull a clinical trial off the ground.
Hi there, this is Jonathan Linder from the University of Virginia. I am a physician scientist, cardiologist. I am the vice chief for research in the cardiovascular division here at UVA, and I lead a real multidisciplinary laboratory that has been investigating new uses of ultrasound for not only diagnostics, but also therapeutics, including gene delivery for several decades. So the use of ultrasound for gene delivery really expands well outside of the brain. there are so many diseases that affect many different organs that have their origins in abnormalities in genetics, things that we were born with. Examples of those are, for example, cardiomyopathy, certain heart conditions where the heart becomes either weak or becomes thick or becomes stiff and dysfunctional, leading to heart failure, all from genetic abnormalities. These genetic abnormalities can essentially target abnormalities in your muscle cells' ability to squeeze, or they can result in abnormal accumulation of toxic compounds or other compounds that make the heart thick and stiff. So that's just an example of genetic diseases that affect the heart. But there's many other diseases that probably most of you have heard about, things like muscular dystrophy that affects muscles. There are diseases of the kidneys that essentially cause kidney dysfunction and leads to patients being on dialysis. So all of these are potential targets of gene therapy. One of them that I didn't mention was blood diseases, things like sickle cell. Some of you may have heard about gene therapy being successful in sickle cell disease, and that is true. And in sickle cell disease and other hematologic diseases, it's possible to essentially do a bone marrow transplant where you put in genetically modified cells. For all these other organs like the heart and muscle, brain, kidney, these are all organs that we essentially can't replace. So we have to essentially insert genes into the tissues of interest. Now, the process of doing gene delivery in diseases of the heart or skeletal muscle like muscular dystrophy or kidney are somewhat different than some of the applications that are being used with focused ultrasound in the brain. Here, we need to do is to be able to cover the entire organ. It's really imperative that we essentially deliver the gene throughout the organ of interest. And because of that, there's a slightly different approach where highly focused ultrasound that essentially gives you a pinpoint of high ultrasound energy to promote the genes to go into cells, out of the blood vessels and into cells, is not going to work. That doesn't mean we're not taking lessons from focused ultrasound to kind of figure out the ultrasound approaches that we need to get genes out of the blood vessels and into the cells of interest. Now, some of the approaches that are being used are essentially ultrasound alone, okay, that is being used all over the organ, or ultrasound in combination with something called ultrasound contrast agents. These are tiny little microbubbles, tiny bubbles about the size of your platelets, the smallest blood cells of your body, that vibrate in the ultrasound field and actually produce effects in the blood vessels to promote the uptake of certain genes into tissues. And so those are approaches that are being used to enact gene therapy in diseases other than the brain. So there are really two main hurdles in terms of doing gene therapy for organs such as the heart, skeletal muscle, or kidney, or other organs like that. The first one is, how do you actually do a large organ instead of a focused ultrasound to a pinpoint target? And really what this is going to entail is three-dimensional ultrasound exposures. So, a problem for us to overcome is our ability to generate the ultrasound environment, how strong the ultrasound is, what the ultrasound frequency is, and to do it in a three-dimensional volume that covers the entire organ of interest to be able to promote genes to go into the cells of interest. The second major hurdle for doing this is, how do you get the genes into the specific cells that you want them to? So let me give you an example of that. Let's say that we're trying to put a gene into a heart muscle cell in order to cure a cardiomyopathy, an abnormal heart function that leads to heart failure from a genetic disease. Well, if we intravenously inject in a gene, let's say a gene that's packaged into some form of a viral vector, for example, the ultrasound can promote the exit of that gene out of the blood vessel. But how do you control whether it goes to the heart muscle versus, for example, blood vessel cells, or cells immediately outside of the blood vessel that support blood vessels? There's many other cells in the heart other than just the muscle cells that are squeezing. So those are the challenges that we have for essentially doing gene therapy in large organs, which is number one, how do we get it to the entire organ? And number two, with a lot of different types of cells within the heart or the kidney or skeletal muscle, how do we get it specifically to the cells that we want it to go to? And those are all hurdles that are essentially being addressed by ongoing research projects.